All right, today we're jumping into a really fascinating and, frankly, powerful class of antidepressants known as MAOIs. Now, these can be absolute game changers, but, and this is a big but, they come with a very specific set of rules you absolutely have to know.
But before we get into the nitty-gritty, let me ask you something. What could possibly be dangerous about aged cheese and a nice glass of red wine? I mean, that sounds like a perfect evening, doesn't it? Well, for someone on a certain type of medication, that exact meal could actually be a ticket to the emergency room. And the why behind that, that's exactly what we're going to unpack today.
So here's what we've got on tap. First, we'll look at what makes MAOIs both so potent but also so perilous. Then, we'll dig into the science behind that crazy food interaction. After that, it's all about the safety playbook. We'll look at 4 specific MAOIs and wrap up with how to handle a worst-case scenario.
Okay, so Section 1. Let's talk about what makes these drugs so different. You can think of MAOIs as the heavy hitters of the antidepressant world. They're not usually the first thing a doctor tries. They're kind of like the specialists that get called in when other treatments just aren't cutting it.
So how do they work their magic? Well, the name kind of gives it away. Monoamine Oxidase Inhibitors. See, there's this enzyme in your brain called monoamine oxidase, and its job is basically to clean up certain neurotransmitters. What MAOIs do is they inhibit that enzyme. They block it. And when that happens, those feel-good chemicals, serotonin, norepinephrine, and dopamine, they get to stick around longer and build up. And that can have a huge impact on your mood. And because they pack such a punch, doctors often turn to them for some really tough-to-treat conditions. We're talking things like atypical depression or depression that's just resisted everything else, but also things like PTSD, severe panic disorder, and social anxiety. For people who've been struggling for a long time, these drugs can be, and I mean this literally, life-changing.
Okay, so now we get to the flip side, the big risk. This is the answer to that cheese and wine question from the beginning. It's the one thing that truly sets MAOIs apart and why you have to be so careful with them. It's all about something called the tyramine interaction. What we're talking about here is something called a hypertensive crisis. And let's be clear, this isn't just, oh, my blood pressure's a little high. No. This is a sudden, severe, absolutely life-threatening spike in blood pressure. We're talking numbers rocketing past 180/120. That is deep in the danger zone. And the scariest part? It can be triggered just by eating the wrong thing.
So let's break this down. On a normal day, without an MAOI, you eat food with an amino acid called tyramine. Your body's MAO enzyme just breaks it down. Easy peasy, no big deal. But when you're on an MAOI, that enzyme is blocked. It's out of commission. So now, that tyramine from your food has nowhere to go. It just builds up and up and up to toxic levels. And that is what sends your blood pressure through the roof. It's a really simple switch, but a really dangerous one.
Okay, so with a risk that big, you're probably wondering, how can anyone take these things safely? Well, that's where the safety playbook comes in. And listen, these aren't just friendly suggestions. These are hard and fast, non-negotiable rules for anyone on an MAOI.
Yeah, strict adherence is essential. It doesn't get much clearer than that. This is not some fad diet you can have a cheat day on. This is a critical part of the treatment itself. And you have to stick to it the whole time you're on the medication and for a few weeks after you stop too. You got to give your body time to get those enzyme levels back to normal.
So what kind of food are we talking about? Let's start with the big ones. Cheeses and meats. The 2 words you need to burn into your brain are aged and cured. Think about it. Aged cheeses like cheddar, blue cheese, Parmesan, cured meats like salami, pepperoni, prosciutto. As these things sit and age, their tyramine levels go through the roof. So yeah, they are completely off the menu. No exceptions.
And it's the same deal for a lot of other fermented stuff. Things like pickled or smoked fish, aged alcohol, so yeah, red wine is out, and a lot of beers. Even fermented soy products like soy sauce or miso soup are packed with tyramine. The rule of thumb is pretty simple. If it's fresh, it's probably fine. If it's been aged, cured, pickled, or fermented, you have to stay away.
Okay, and this is huge. It is not just about food. The danger of a bad interaction extends to other drugs too. You absolutely cannot combine an MAOI with other antidepressants, like SSRIs. But it's also common stuff, like over-the-counter decongestants you'd take for a cold. Super dangerous. Stimulants, also a big no. Even that herbal supplement, St. John's wort, you have to avoid it. And this is why doctors have to be so incredibly careful when switching someone onto an MAOI. There's this other risk called serotonin syndrome, which is basically a dangerous overload of serotonin in your brain. To avoid that, there's a mandatory washout period. That means you have to be off most other antidepressants for at least 2 weeks before you can even start an MAOI. And for a really long-lasting one like fluoxetine, that waiting period is 5 weeks. It's serious stuff.
All right, so let's get a bit more specific. Not all MAOIs are exactly the same. Let's take a quick look at 4 of the main ones you might hear about.
Okay, so you've got Isocarboxazid. Honestly, you don't see that one much anymore. Then there's Phenelzine. This one tends to be pretty sedating, so it can be a really good fit if depression comes with a lot of anxiety or insomnia. Now, the opposite of that is Tranylcypromine, which is more activating. It can give you energy, but can also make it hard to sleep. And then there's the really unique one, Selegiline. This one's a patch you wear on your skin. And what's cool is that at the lowest dose, it can actually get the medicine into your system without going through your stomach, which means the diet rules might not be as strict. It's a real game changer.
And that brings us to our last section. And honestly, this might be the most important thing we talk about today. What do you do if something goes wrong? Knowing the signs of a hypertensive crisis and exactly what to do could literally save a life.
Okay, lock these into your memory. These are the red flags. The number 1 sign is a sudden, awful headache. People call it a thunderclap headache, often right at the back of your head. Along with that, you might get a really stiff neck, your heart might start pounding, you could feel sick to your stomach, start sweating, and just feel an overwhelming sense of panic or anxiety. Spotting these signs right away is absolutely key. If you or someone you know feels this happening, the game plan is simple, and there is 0 time to waste. Step 1. Stop. Whatever you just ate or took, stop. Step 2, emergency room. Right now. Don't call your doctor. Don't wait to see if it gets better. Go. This is a 911 level emergency. And step 3, once you're there, the medical team will take over. The likeliest fast-acting IV drugs to get that blood pressure down to a safe level as quickly as possible.
So, when you put it all together, what's the bottom line? MAOIs are some seriously powerful tools. They can be miracles for people who've tried everything else, but that power has to be respected. It comes with a huge responsibility for the doctor prescribing it and for the patient taking it to follow the safety rules to the letter.
And you know, that really leaves us with something to think about. The whole story of MAOIs is this perfect balancing act of high risk, high reward. And it just makes you wonder, doesn't it? How much better could medicine be if every patient for every complex medication was this empowered with this level of clear, crucial information? Something to chew on. Thanks for tuning in.